I'm Robin Mathews. I'm one of the cardiologists who work here at Duke. The spectrum in terms of who the kind of patients I see really varies from young patients who just have a family history and they're concerned because they have a young family and they want to try to get ahead of this, to patients who are much older in their 80s and 90s who have advanced cardiovascular disease, heart failure. They've had bypass surgery, valves replaced, defibrillators in place, pacemakers, so really anything along those lines. When I interact with somebody in the office and we have an opportunity to meet for the first time, or even sometimes when you have follow-up visits for them, I think it's very important to empower them. I think one way to think about medicine, especially years ago, was that the doctor kind of makes a decision and a plan and you just kind of stick with the plan. And that seemed to work for a while, but I think what we've realized over time is that there's a lot to be gained by having a patient who's engaged and sharing some of that decision making. So the object of a visit, in my eyes, is to be able to understand a problem by taking good history, but to then be able to convey this back to patients so that they have an understanding of what may be going on and why we need to proceed in a certain way. And I think at the end of the day, it's my job to inform them and treat them as if they're a family member or a friend of mine, and to give them an honest, my honest impression of, I think, an opinion in terms of what we should do. But it's also my job to be able to respect what their wishes are and to be able to come up with a decision that is consistent with that.